Fantastic. So welcome everybody to this webinar here with Inner Source Health, two medicines, conventional versus naturopathic medicine. So I'm really excited to have this forum to be able to talk about the two medicines that we have in our society at our disposal to be able to use. And I'm going to just lay some basic foundation, some groundwork for it. I am a naturopathic doctor, so clearly it is from my point of view. My experience over the many decades going to both conventional medical doctors and naturopathic doctors. So it will be my perspective. So any other perspectives are welcome too. And everyone has their own experience, with medicine. So I'm simply going to be sharing my experience to hopefully provide some insight. Clearly, there are reasons why I chose to become a naturopathic medical doctor, but I hope the point of this is to show how we really can combine both medicines. And when they're used properly and effectively, we really can climb mountains and reach a new sense of vitality, and ultimate health can really be achieved. So the point is to really shed light on the beauty of both of them and to also make it aware of sometimes when to rethink whether to go to one doctor versus another type of doctor, because there are always options. And you always have to listen to that inside voice, right? Because they're always telling us what's best for us, right? So what's best for one person might not be best for you. So that's why I'm glad that you're here, we can have this nice discussion on this webinar today. Okay. So which road to choose, right? We always have options in our life. And when it comes to our health, we have options of who we would like to see. And can these two worlds of medicine coexist? So that's a burning question, and that's what I'd like to dig into today between naturopathic and conventional medicine. So I am Dr. Dawn Siglain. It's much easier for people to just say my first name, so I go by Dr. Dawn, and I am a naturopathic medical doctor. I am licensed in Connecticut. I'm currently practicing at Inner Source Health in Huntington, New York, right in the heart of our village here. And we do also have an office in Manhattan. I also have my master's of science in acupuncture, so I love to combine traditional Chinese medicine with my patients, if they so choose. And I'm also a Reiki practitioner, which I love. My specialty is autoimmune conditions, and I also do work with pulmonology too. I think respiratory and lung health is really important. And these ended up becoming my specialties because I had chronic conditions with both of them. I had an autoimmune condition and also a chronic mild obstructive lung disease, actually. So I'll be talking about those too and how I went about dealing with those. So what is a naturopathic doctor? So if anyone on here is new and have not met with myself or any of my colleagues or seen a naturopathic doctor, we have a holistic view of medicine. Okay, so that's incorporating the whole person. I'm going to go more into detail about what that means. So sometimes, we really have to get to the root cause. So that requires really understanding our patients through and through. And it is traditional medicine. So there's ancient remedies that have been used over time, and they're wonderful. And there's so many different modalities that we're able to use. Naturopathic medicine is individualized care. So that's how we work as doctors, working with our patients. So it's specific to our patients. One health plan. I've never created the same health plan for all my patients throughout the years. It's always specific to them. And our focus is finding the root cause. So in a visit with us, it's the first visit is very lengthy. Our visits here at the office, our initial visit is 90 minutes. So we ask a lot of questions. It's a thorough medical intake. And we ask all these questions because we're trying to find out what the root cause of the imbalances within the body. It's really key in bringing the body back to balance. And we have an understanding of biochemistry. So, we did study basic sciences just like medical doctors. And with that, we But we had to understand biochemistry, and we really bring that into clinical practice. So it does apply to our patients, and our use of natural therapies properly and effectively. Okay, so there's a difference between just taking a bunch of supplements, but taking the right supplements for you at the proper dose for the correct amount of time. So it is very specific to the person, and that's how we've been trained. So we had to go through schooling for that. And principles of naturopathic medicine. So first, do no harm, right? To find the least invasive way to try and help and heal. And then the healing power of nature. It's right in the name of what we do. So we look to Mother Nature and all the wonderful foods and things that we're able to obtain from nature in order to heal, to bring ourselves back to balance with that. And identify and treat the cause. So that root cause, what is it? And then move forward with treatment. Doctor is teacher, so constantly educating, having open conversations with patients about how they can bring their body back to healing. So there's so much to learn while working with the naturopathic doctor. So we really help you to get on your way, understand your body, as you move forward in life, bringing that body back to balance. It's healing isn't a straight line. Sometimes you have it, you're going to have good days and bad days, and understanding the body and knowing when to bring the body back to balance and what your body needs. It's really enlightening. People really do love it. Treat the whole person. So we're not just looking at specific organ parts. We're seeing how everything works as a whole, and how that measures out and is affecting you and your health. And prevention. So preventative medicine is key when it comes to chronic illness, chronic disease. Knowing and using preventative medicine is tremendous in reversing and preventing things in getting worse. So preventative medicine is core to what we do. And there's tons of ways that we're able to then apply our principles of naturopathic medicine. So first and foremost is nutrition. So you'll get a health plan. I'll talk about that a little bit more. All the things that you could eat versus some things that you should not be eating. So this can be really eye-opening for some people. I get it a lot. People say, but I'm eating healthy. And then we really break it down. Some of those foods that they may have thought were quote unquote healthy or actually causing them to feel unwell. So it can be a really great conversation to have, and then to work on a plan and maybe create meal plans if that's necessary. Botanical medicine, the whole world of herbs that can help bring the body back to balance. Vitamin and mineral supplementation, again, using the right dosage, getting third quality party tested supplements is key. There's a lot of bad supplements out there, guys. So you have to be careful making sure that you're getting really quality supplements. Homeopathy is wonderful. We've been trained in that. Naturopathic doctors are trained how to use homeopathic remedies and to prescribe, and that can really be a huge part of the healing process. It's very gentle, and they really are some lovely remedies that can be used. And all the healthy lifestyle habits. So as you're working with myself or a naturopathic doctor, there's suggestions that we can make that you can bring into your life. So whether it be exercise, detox, meditation, getting into a more relaxed state in your body, tapping into that parasympathetic nervous system, all the ways that you can do that. I love when it comes to exercise, working with the blood type specific exercises for people. So different blood types release cortisol, the stress hormone, differently. So I love to use that. That ends up being a really great tool. I say it works really most of the time. So exercising, proper movement is key, and balancing that with also having enough time to rest and relax. Physical adjustments. So in different states have different, so based on licensure where you're at. So when I was in Connecticut, we were taught in school of doing manipulations. So we could do the physical adjustments as chiropractors are taught with patients. So doing any kind of work on the cervical spine, the thoracic spine, the lumbar spine, throughout the body, any foot adjustments, things like that. So find out with your state if that's something that naturopathic doctors can do, if that's something that you're looking for, and find a naturopathic doctor who feels really comfortable with doing manipulations. But that is something that we are taught in school. And other modalities. So depending on the state, different doctors in states that are licensed and have the prescription to prescribe pharmaceuticals can even prescribe pharmaceutical medications. That is not the case right now in New York, but if you live on the West Coast and other states that are licensed and that can do that, your naturopathic doctor can do that if that's something that you are looking for. So conventional medicine, and there's lots of benefits I'm going to go into, how they really can complement each other. So it's typically our standard, modern, or Western medical care. I also refer to naturopathic medicine as Western medicine too, because it does have that mindset. But there's a big difference though between the conventional and naturopathic medicine. So not to get that confused. And doctors with there. So we've got medical doctors, osteopathic doctors, there's physician's assistants, registered nurses, nurse practitioners, the list goes on and on. I know lately when I've been seeing doctors for the past few years, I've actually been seeing PAs and they've been really lovely. But again, it's a different designation. So to be prepared sometimes, if you book an appointment with a doctor, if you want to know who you're meeting with, it's a good question to ask if that's important for you. So that has happened to me quite a number of times over the past couple of years, but the PAs were very knowledgeable and I quite enjoyed their care. Common treatments. So conventional medicine has been trained to prescribe pharmaceutical medications, which can be very effective when used properly. Again, just like using supplementation properly with naturopathic medicine. Sometimes surgery is necessary, radiation. These are different types of modalities that they use. So very different. You go to those doctors also for imaging that can be done. So I refer out a lot of times for imaging, getting those abdominal ultrasounds, see what's going on, dig a little bit deeper. We have to use conventional medicine to be able to do that. I love that. But what they do have, and it's different, is they have a reductionistic view. So if there is a certain ailment in a body part, they hyper focus on that. And that is the way that it works. And sometimes that is very effective, especially with acute situations. So training in conventional medicine, again, I did not go through medical school, so this is the best way for me to explain it. So if there are any medical doctors out there and I am leaving stuff out, which I am sure I am, I do not intend to do that with any disrespect. I am trying to provide the information that as I know it to be. So the standard model of care is to diagnose a disease and match that disease with a corresponding drug. And there's lots of studies. They like to see studies match up. And I'm going to go into a little bit more about that, how that works. And it's very effective for an acute condition. I should have written acute condition there, really. Any trauma, acute infection, and emergencies, okay? We're really lucky to be able to have that and access to this medicine. What it does tend not to bode well with is chronic disease. It does tend to overlook that root cause. And a lot of times this happens because there's just not time in the visit. One of the things that I was searching for a long time when I had my autoimmune condition, which ended up turning into lupus, for decades, I was going to see doctors and I would always go with such hope, wanting answers. But unfortunately, the visits are very short. And I'm going to go into that more so. And I never really got to explain what was going on. And so it's one of the many reasons why I sought out naturopathic medicine, because having that time to discuss and do proper lab testing to understand, then I was able to get a handle on the autoimmune condition to be able to reverse it, which was great. So chronic disease, when it comes to conventional medicine, if you've been suffering for a long time and you've only been able to see conventional doctors, I urge you to look for a naturopathic doctor, because this is really where we do shine. So let's compare and break it down a little bit here. So naturopathic medicine has that comprehensive medical intake, right? So it's a 90-minute visit. So there's lots to discuss, and we're asking everything from your prenatal health, how you were born, how you came into this world, what your childhood was like, up to what you had for breakfast that day. We want to know everything and all in between. What triggers you, what makes you happy, what are your hobbies, and all that stuff. It's really important. If you have any labs, bring them in. Happy to look at those too. Naturopathic medicine includes ancient remedies plus up-to-date research. So we do keep up with the research. And something to be said about research, which is known now, is that depending, studies and research can be funded by certain companies, and that can have an effect on the outcomes. Sometimes that happens. So being aware of that, understanding that, and really comparing different research is important. Understanding that root cause of medicine. Okay, I can't stress this enough. When you find that, it can really make the case and the person can present in a way that you have that true healing. So finding that root cause is so key. So it's so important to take this time to understand, to find out what's going on. We treat the whole person. And it's an individualized health plan, like I was saying before. And we can treat acute conditions. There's lots of acute conditions. We see a lot of kids come through, a lot of pediatrics come through our office here, and we're able to help them with the cold and the flu, and with any viruses too. So very effective. Conventional care. So on the flip side, it's quick and symptom-based appointments. So if you have an acute condition, you're in a lot of pain, you want a quick fix, that could be a better route for you, right? So they have quicker appointments. It's the way that it's handled for the most part, and you can get in and out there and find quick relief if needed. They do use modern science, lots of research and scientific data. It is symptomatic care. So again, it could be a Band-Aid to make you feel better. You can walk out of there feeling better. It does, instead of treating the person, it treats the disease. In contrast to whole person, there's a reductionistic view. So instead of looking at the whole person, they're looking at one portion. And sometimes that is what's needed. In naturopathic medicine, I said the individualized health plan for a person. In conventional medicine, the treatments are based on larger population. So typically there have been studies that prove that a certain drug can help this situation or condition or disease. And because of the studies that have been done on it, the treatment is, X and Y equals Z. And that's just what they do. So regardless of what might be going on with the person, with their digestion, etc., if there's something because they have, let's say, diabetes, then that's what it is. And it's great for acute and emergency care. Okay. So some big takeaways. Okay. So just to really drill some points home here. So naturopathic visits, they are longer visits, especially that initial visit. Okay. So be prepared for that. Be prepared to talk. There's a lot that we want to know about you. So it's really important. Conventional medicine is shorter visits. That's the way that the system is created. Naturopathic medicine licensure in the US varies in each state. We are slowly but surely, each state is getting more and more licensure. We are working hard in New York to get licensed. In conventional medicine, it is licensed countrywide. Okay, so when you see a medical doctor, they're all licensed in each state that they're working. Naturopathic medicine could go through insurance if you're in a licensed state, or self-pay too. Okay, so if you have any questions, you can always call our office. We can explain that to you in more detail. And conventional medicine is typically covered by insurance primarily. Okay, with the exception of some doctors. I know some conventional doctors who do out of pocket. But for the most part, that's how that works. Naturopathic medicine, we do have emphasis on nutrition, and lifestyle, right? What are you doing? What are you thinking about? What's your mindset? Are you exercising? Are you moving your body? Are you feeling good? What's going on? Okay. With conventional medicine, the emphasis there is typically medications are typically prescribed. You walk out of there with a prescription. I know that that's what happened with me a lot. And I remembered when I was young, I know this is one of the reasons why I do what I do. I always wanted to talk about my feelings, talk about what was going on, and always be so excited to go into a visit. And I remember more than often not the doctor, and I understand how difficult it is to be charting, talking to the patient, as well as, writing out a prescription. And there wasn't oftentimes that connection, or asking too many questions, or even looking each other in the eye. And I really kind of needed that. And I knew that I was looking for that. So, but sometimes people don't want that. So, to each their own. So, different strokes for different folks. But that's how I found naturopathic medicine. It definitely resonated more with me. Because we're complicated. We're complicated people, humans. It's not an easy job being a human, right? There's so many things that we go on every day. We're ebbing and flowing. With naturopathic, we support the normal healing of the body. With conventional medicine, there's a direct attack of disease dysfunction, right? There's a disease, let's kill it. Let's get rid of it. Kill the virus, right? All these things, instead of how can we heal the body so that we can be our best defense against a virus, an illness, prevent disease, reverse the disease, have proper immune support, all these things that are really important. It's a different view of it, right? So it's not as combative. We're really trying to work with the body and work with nature. It's a very, very different view on medicine. We believe in that natural ability of the body to heal. So this is huge. Aiding the body, giving the body what it needs, and then seeing it flourish. And with conventional medicine, it's drugs holding the healing capacity. This medication will heal you. It's a different mindset. With health, there's vitality in naturopathic medicine. Conventional medicine, they look at health as the absence of disease. I can't tell you how many times when I wasn't feeling well, doctors would look at my labs and say, but you're fine. But I didn't feel well, but all my values on my labs were normal. So in their minds, I was healthy, but I knew I wasn't healthy. So I had to seek elsewhere. So it's very different. And it's very frustrating. So if anyone out there can relate, it's very frustrating when you don't feel well and then you have a doctor telling you, but you're fine, because you know that you're not. And it's treatment for the person in naturopathic medicine. And conventional medicine, it's treatment for a diagnosis. Okay, so it's different ways that we've established our oath in medicine, and it's just simply different ways that we treat. Okay. And so when it comes to lab reviews, so I was just talking about this before. So there's a big difference between optimal and normal ranges. So optimal is what our naturopathic doctors seek. So it's a smaller window that we're looking at. So when you're in that optimal range, you're really feeling good. The body's really thriving. With normal ranges, there's a larger window. So some things can really get missed if you're in that larger window. And I see this a lot, time after time, with vitamin D. So with naturopathic medicine, the optimal range there is between 60 to 80. On labs, the range is from 30 to 100. So I have patients come in and they've got vitamin D at 31, and they're clearly not feeling well, but they've been told that it was normal for them. Again, that's how in conventional medicine they're trained, because that's the normal range. But that's simply not the case for really feeling your best. And vitamin D is more than a vitamin. It's a hormone. It supports our body in so many different ways. You really want that optimal range. So then getting the proper type of vitamin D is key. So getting some nice vitamin D3 to help to support the body, get it up, get the right amount that you need, and then get retested to make sure that it's increased, and then you're feeling good. So it's a totally different approach. And that's just one example. And there are so many more examples that I can give you. But it's key to having labs in optimal ranges. So just to drill it home a little bit more, so the normal ranges is just like I was saying, so great, you're alive, but you don't feel well. So it's so confusing when you're really looking to feel well. And if you're going to someone who's only looking at the normal ranges and you've been having a chronic condition, you want to seek more optimal ranges. And also, you want thorough lab work done too. You want to be looking at micronutrients and looking at things like magnesium, iodine, zinc, vitamin A, vitamin E, all the B vitamins, all these good things that the body needs to feel well. And so there's so many more things that we can run instead of just basic labs, which is really great. With these optimal ranges, then we can foresee the imbalance in the body before the symptoms appear. So why wait for any symptoms to show up when you already don't feel well for so long? And that's what was happening with me. With lupus, with my autoimmune condition, I had a positive ANA on my lab, and I had really cold hands and feet. And then as I got older, they were getting even colder. And then when I was getting sicker and sicker, I ended up getting more joint pain. And then the body started, so I always say the body whispers to you, it talks to you, and then starts screaming at you. So a really good time to get to a naturopathic doctor is when the body's whispering to you. Get these optimal ranges done, figure out what's going on. And if you can reverse the condition before the symptoms get worse or before you get more symptomatic, that's really best, okay? Don't wait until the body's screaming at you. But of course, if it is, then you have a choice, okay? Do you want to go the conventional medicine route, or are you even willing to still work with a naturopathic doctor when your body's screaming at you? These still are options for you, and it's just something to think about. So really knowing your body, knowing when it's out of balance, and seeking the right care when you need it is key. Avoiding or reversing chronic conditions is really what can happen when you understand these optimal ranges. And there's specialty labs that we can run also. So it goes beyond just basic blood work. There's urine tests that are really indicative of hormones, and that can give us a really good snapshot of what's going on in the body. We also do thorough stool tests. So those give us a lot of information too. What's going on in the gut. In naturopathic medicine, they always tell us, when in doubt, treat the gut. So there's so many things to look at within the body. So the clinical presentation. So when you go in to see whether a medical doctor or naturopathic doctor, so in conventional medicine, they're assessing just like a naturopathic doctor is, right? We're asking our questions. We're trying to get to know our patient, ask the important questions that we need to ask. We'll both do a diagnosis or something called a differential diagnosis. In naturopathic medicine, not necessarily required. We can just, talk about symptoms. We might not have a diagnosis. We can still get to the root cause without a diagnosis. So that's key. So you could just come in not feeling well. We can still try and get to the root cause. And then with conventional medicine, typically a prescription is handed out, or you get referred out. Naturopathic medicine, at the end of each visit, you get a health plan. I'll talk more about what's involved with that. And then we might also refer out. You might have to get more imaging done. And then also, I love to offer combined care with my patients. So working with your other doctors, sending them my treatment plans, having conversations with them to really open up those lines of communication to see how everyone's working on and helping our patient. It can provide a lot of insight and be really helpful. So what's in a health plan? So there's three major parts to the health plan. First and foremost, I've been talking a lot about this, is nutrition, right? So what food as medicine, what we're putting in our body is so important. Put all the good things in there. It makes a difference. You'll feel better. We all know to a certain extent what's right for us, but you can take it to the next level with your naturopathic doctor, and they can really give you a lot of insight for that. Healthy lifestyle changes for you. So some healthy habits to benefit your health. So do we have to work on lymphatic drainage? Do we have to work on detox? Do we have to get you motivated to work out? Do we have to give you some ideas to work out? What's the best type of workout for you? Could you be doing a workout specific for your blood type? And that can really help you. Do you need to meditate more? Do you need to be grounded? Do you need to get more into nature? Maybe you're lonely. Do you want to adopt a pet? I mean, all these things, the list goes on and on. How are you sleeping? Where's your phone next to you at night? Do you have it in airplane mode? Is it maybe sitting downstairs or out of your bedroom? What's going on at night? How are you feeling in the morning when you wake up? All these things are important. And can we give you some tips on some lifestyle changes to help improve that? And then the proper supplementation. So if supplements are necessary, we'll properly prescribe them, the right dose. And they always warned us in naturopathic medical school about green allopathy. So not just taking all the supplements under the sun, but taking just what you need. So less is more when it comes to supplements. So really fine tuning that, taking the supplements that you need, the proper supplements for you to bring your body back to balance. Okay. And weaning you off of supplements when they've done their job and you don't need to be on them anymore is a crucial part of being on supplements, right? So what's different about me? So I also like to add into my health plan something called daily affirmations. And I write them down. Actually, I've got my whole array of them here, all the different colors. I write them on these little cards, and they're all aligned with different chakra colors. So I pick a color. This is a greenish. So let's say I'm working on detox or supporting the liver in some ways. I'll write it on these cards for them. And this card is to be placed in the mirror for you to say and see every day and say it in front of the mirror. And it's a lovely tool to empower yourself to feel better. I remember one of my favorite affirmations with one of my first patients. We were working on I was working with her cardiac health, and I gave her this affirmation: my heart beats to the rhythm of love. And she loved that affirmation. She sang it. She said it all the time. And I'll never forget it. And it was a really powerful one for her. I remember I tried to change, because every time they come in, I ask, how are we doing with the daily affirmation? Do we need a new one? And she just wanted that one. She wasn't budging from that. She loved it. She sang it. It perked her up. It was a good one. So not everyone ends up singing their daily affirmations with me in the office, but the point is to empower yourself to feel better, because you really are in the driver's seat. As your doctor, as your naturopathic doctor, we're here to support you and guide you and help you along the way. But it's really up to you to follow through with the plan, be compliant with any suggestions that we make, be in touch with us. So you can always contact us in between visits, give a call, message us through the portal, touch base if you need any assistance with the treatment plan as you're moving through. So we're there for you that way as well. So it's nice. Sometimes people like to be able to reach out to their doctor in between visits for some guidance. But these are all parts of the health plan. So that's my little last fourth touch on it. So the possibilities are really endless. So we have many tools in our toolbox as NDs. That's the way that I see it. There are different things that conventional medical doctors go do, but typically you're booking appointments with an endocrinologist, with a gastroenterologist, and they're looking at specific body parts with a gynecologist. They're looking at those specific body parts. That's how they've been trained, and that's how they treat and prescribe. So it's a different way when you're doing that. And each doctor, respectively, has their own ways of working. So with NDs, we're looking at the whole person. So we have many tools in our toolbox, all different things that we can use. So it's not just supplements, it's not just nutrition, it's not just lifestyle changes. There's so many things. Sometimes talk therapy is what you might need from an ND that we can do. Some NDs do some biofeedback. There's tons of kinesiology, there's all different sorts of things. When it comes to supplements, if someone doesn't even like a capsule, we can do tinctures, right? So we can make combined tinctures, some delicious tinctures, some that are warming, some that are a little cooling, some that are good for digestion, with some bitters in it. Whatever it is that the person needs, we can make beautiful tinctures with it using botanical medicine. There's beautiful custom Bach remedies that we can do. Those are flower essences. I love them. We can do neurotransmitter testing and support the body in that way. So there really are so many different things that we're able to do and address with our visits. We meet our patients at their comfort level. So I'm always asking my patients, are you okay with the supplements or the tinctures? Sometimes I'll even make, if people don't want to take too many, it's too complicated for them, I can make custom supplements too, and people really like that. That can be in powder form or capsule form for whatever they want. I can always get a feel for patients. As I'm talking to them, we have that 90 minutes when I'm first getting to know them. I'm kind of getting a feel for what their comfort level is. So before I hand over my health plan, we've already spent some time together. So I'll be able to make recommendations accordingly. And I always love to talk about like being your advocate for your patient, really giving them a voice, telling them what to ask for sometimes. So if I have to refer out, I explain to them why they're going to a certain doctor for a specific reason. I really go through labs and explain what the values mean, what it means for them, why it's so important to take certain supplements or certain vitamins and minerals based on certain lab values too. So really empowering the patient, educating the patient, having that conversation with them about their health gives them the power to want to find out and get to the root of what they need, or maybe if they have to go with other doctors. So really advocating for the patients is so important. And I say that because with myself, with suffering with my autoimmune condition, I would say I don't feel well, and doctors kept saying, but you're fine. So I really was advocating for myself, and I had to go through it, and it wasn't easy. I'll have to say that. I got knocked down a lot, and it was really tough. But I came out on the other side, which was wonderful. But it wasn't really handed to me and that easy to do. So I had to find naturopathic medicine in my own way, and I'm really grateful that I did. So being your own advocate, and that's what I had to do for myself with my situations. So I'll use this as an example. So when it comes to autoimmune conditions and having proper immune support, when it comes to pain, when that chronic inflammation has been burning like a raging fire for so long, how does this settle in the body, and how do each medicines kind of look at it? So I think that this was really interesting, and I like putting this together. So the answer that conventional medicine has is to suppress inflammation. Now, that's important, and that can really help when you're really at end stage, you're in such dire pain, and or your life is at risk, right? And that's what was happening during this pandemic. Using medications such as immunosuppressive therapy, steroids, right, or oral injection or creams to suppress the inflammation, because it's overacting on your immune system, and it actually can take your life. Now that is a cause for it, but using suppressive therapy with autoimmune conditions, when you're still functioning and you're able to walk around and get around, and you're just trying to calm down the inflammation, is different. So naturopathic medicine addresses the root cause of chronic inflammation with autoimmune conditions very differently, because it calms down the inflammation and it also can reverse the inflammation. So this is key, because then the true healing occurs. So if you are in a state, let's say with me, I had a positive ANA, but years ago, my lupus marker wasn't showing up. You can calm and reverse that inflammation. I didn't have to wait for the lupus marker to show up. Naturopathic medicine, had I found it decades and years earlier, I could have avoided all the symptoms that I ended up feeling later on in life. But conventional medicine didn't know what to do for me. And I certainly wasn't going to take any kind of suppressive therapy, because I knew I didn't want medication. I was just trying to figure out how to feel better. So with my case, I was always taught, oh, you have Raynaud's and you have poor circulation. So I said, well, what does that mean? There was no answers for it. And there were no medications, because I wasn't in that bad of a state. So I didn't do that. I didn't choose that route. And I'm glad that I didn't. But what I see now, when people have autoimmune conditions and you go to, let's say, a rheumatologist, the treatment there is it's suppressive therapy. It's different. So know where you are. If you still have that vitality about you and you want to reverse the chronic inflammation, going a more holistic naturopathic route could really benefit you, because I think that you'd really then find the answers that you want. When it comes to autoimmune disease with conventional medicine, they have a different approach to it. And again, when you're in a dire state and your life depends on it, then is the time to really think about that and have that come in. So there is a time and a place for it. When you calm and reverse that inflammation with naturopathic medicine, the symptoms alleviate naturally, no side effects. So this happened with me. So with the lupus, it grew. It got, not only did I have the cold hands and feet, now they were turning purple and white, really, really, and it was turned out to be more painful than numbness and tingling and cold. It was so painful. I started having real weird pain in my joints, and I'm an avid exercise, always working out. I had this weird pain. I didn't injure myself, didn't know where it came from. This extreme fatigue. I was getting swollen hands, and just my lower legs were really swollen. My boots couldn't even fit. I was like, what's going on here? What else was going on? There were so many weird symptoms. Oh, brain fog. My mood was affected. I was depressed. It wasn't good. But when I calmed down the inflammation, luckily for myself, within months, all the symptoms went away. It was really great. Naturopathic medicine has a comprehensive intake, and it's a holistic health plan. So with the care, so with conventional medicine, there's symptomatic care. Remember, I was talking about symptomatic care to manage symptoms, which are really good in acute situations, okay? You just want a quick fix. That's what you can get. When it comes to autoimmune disease, sometimes that quick fix has ramifications down the line. So the symptomatic care to manage symptoms, there's NSAIDs, which is pain and inflammation. Unfortunately, long-term use of these can really upset your GI system, ulcers, etc. And then taking something called acetaminophen deals with pain, but it doesn't deal with the inflammation. So you end up feeling better. But then which pathways does this go through? This ends up affecting your liver. So you really have to be careful taking this long time, making sure that you're not drinking alcohol if you're taking those kinds of symptomatic medications. And the side effects with medications are a lot. So unfortunately, if you are taking any kind of medications, take it short term, just when needed, but to know that there are answers beyond just the symptomatic care. Why wait to feel better to pop a pill into your mouth when there's so many things that you can do? So when it comes to autoimmune disease, that root cause is chronic inflammation. So from a naturopathic doctor's point of view, there's so much you can do. You can do the anti-inflammatory diet. So avoiding things like gluten and sugar, and then the family of vegetables called the nightshades. So if anyone's interested about this, I've done lectures about autoimmune conditions, and I go into much greater detail about that. So healthy habits. So we have to work on some lymph drainage? You know, is there some stagnation in the body? Do we have to do detox? Do we have to talk about some exercises that are safe for you if you're having joint pain? Switch it up, try and do some different kind of exercises. And supplements. So there's natural anti-inflammatories, natural antioxidants, and based on lab work, if there are any deficiencies, so you supplement with that. Now you're empowering the body to come back to balance, right? We're calming and reversing that inflammation naturally by giving the body what it needs. So it's a totally different perspective. So I hope what we're gathering from this is that there's a time and a place. So understanding that root cause of the ailment can be really beneficial for you. As well as knowing that both medicines are effective when used properly. So this is key. So, you know, and I'll talk about, so I had mild obstructive lung disease, which I found out randomly. I was doing a workout, and because I didn't really have breathing issues, but I was doing a workout. It was a cold day. I was on this elliptical at a really high incline. And I had a cold sensation that lodged in my sternum, and I couldn't catch my breath. And I had shortness of breath for 2 days. I ended up, you shortness of breath, you go to two things. You think about your heart and you think about your lungs. So I went to cardiologist, heart was clear. I go to the pulmonologist. He's like, oh, your lungs sound good. You're young, you're healthy. I think you're fine. And I said, no, there has to be something wrong. Um, and, you know, mind you, naturopathic medicine, I didn't even think to go to naturopathic doctor. And I was in naturopathic medical school at the time. I knew I needed to go see the pulmonologist. So I knew I needed this testing from conventional doctors. So, and, but it's really interesting how both of them were able to help. Both conventional medicine, naturopathic medicine helped me. So I was, again, being an advocate for your own health. So that's what I did with this pulmonologist. I said, okay, I understand my lungs sound clear, but I know, and you know, shortness of breath for 2 days is not normal for anybody. So he goes, well, do you want a pulmonary function test? I said, yes. So he scheduled that. I came back for it. I had such a problem with the machine. I'll never forget. I told the nurse, I said, I think there's something wrong with it. She's checking the oxygen. Lo and behold, I get the results back. Mild obstructive lung disease. And then when he called me, I said, well, what do I do about it? He goes, there's nothing to do about it. It's going to turn into COPD. And you're going to have to, you know, take a medication for it. And I said, no. I said, what about inhaled glutathione? I'd heard about it in school. I'd read the research and I knew that it was indicated for my condition, and he didn't know anything about it and he couldn't help me. So I ended up going back to naturopathic doctors. I ended up getting the supplement that I needed. I got my nebulizer. I did the treatment. Within 5 months, I was successfully able to reverse the pulmonary issue, which was wonderful because I ended up realizing that there were signs and symptoms that my body was having through it. I used to get this redness and just this feeling of heat in my upper chest here. And now I realized it was from the obstruction there. And then once I cleared that, I didn't have that anymore. And I'm really glad that I was able to do this treatment, because with everything that's happened with the pandemic, I had reversed a chronic condition. And one of the things that is important, I hope that is a big takeaway from what we've been through during this pandemic, is to really know yourself, reverse, if there's any chronic diseases that you have, reverse them ASAP. Don't wait until you're in a pandemic to try and reverse it, right? Because anyone with compromised respiratory issues are really putting their health at stake. So I'm really grateful that I found that. But again, it wasn't easy for me. I had to keep pushing, asking for things, but I did need the testing done with the conventional doctors. But then the treatment was through the naturopathic doctors and the naturopathic way. So I had to use both of them to get and find what I needed. So it is important, and there's not one's better than the other, but really using them properly. And when it came to, you know, with lupus and with autoimmune conditions, I have to say that was naturopathic all the way. So there's specialty tests that was able to detect the antibody, because it wasn't showing up on the conventional labs. So, but that is a test that conventional doctors do run now. It's become more and more popular over the years. And by getting that diagnosis, I then was really able to go full throttle and treat and be able to, I ended up treating myself with that. But it was really wonderful and great and empowering, you know, so when you find out the root cause, you understand that, and you're able to reverse it. And I'm able to then manage my life as I get older, you know. So when you have an autoimmune condition, you know that you're always prone to the autoimmune condition, but you're empowered to not let the flares come up. You're empowered when your lab work is all negative, you know, and you keep it there in hindsight. You know, and you know that if you're bad and you eat some foods and you don't feel good in a certain way, you know why, and you can get back on track. So it's really important. It's really empowering that way. So I hope that you guys have been empowered too. So the beauty of all of this is to have that combined care. So have your doctors talk to each other, you know, have all the cooks in the kitchen, you know, whipping up a meal together, so to speak. So get everybody on the same page for your ultimate wellness. So I love to do that. I love to bring them together. I love having conversations with other doctors. And it does make it possible to have naturopathic doctors and your conventional medical doctors work together. So ask, you know, before you make appointments, are you willing to speak with my other doctors? You know, it's important. And we're also different. So all naturopathic doctors are really so different, just like medical doctors are different, right? So rule of thumb, find a doctor that resonates with you. So what we offer free 10-minute consultations that if you're a prospective patient and you want to talk with the doctor to get a feel for us and how we work, and if you can vibe for us, do it. Call our office and schedule one today. My office manager, Lindsay, she'd be happy to help you. And NDs, we vary so much, right? Just like all humans, like we're all individual. NDs vary too. So, vibe with someone, you listen to a webinar, read an article, see, see how they work, meet them out somewhere at lectures in the area if they're doing that. Really get a feel for your doctors and feel comfortable with them to have these conversations. And so I do a combination of Western medicine. I'm referring to naturopathic when I say that, plus Eastern, the Chinese traditional medicine, and also bioenergy medicine and Reiki, so energy medicine. I can incorporate that. So whatever you're looking for. You can come to me for naturopathic and acupuncture. We can do combined visits with both of those too, if you like. With acupuncture, if we do take your insurance, then we'll do the combined visit with naturopathic and acupuncture. So give a call and see if we take your insurance. My office manager can help you. Also Reiki and then bioenergy is what I have been trained in. So if that's something that interests you, come on in and I'd love to meet you. So thank you very much for joining me. There's all different ways that you can follow me. I'm on Instagram at drdawnd. Feel free to follow me. I'm also on Facebook posting about different lectures that might be coming up, different foods that I eat. So I am a plant-based doctor. Again, I support my patients where they're at. If that's something that you're looking for, I can certainly help you with that. I'm always posting about my meals and what I'm whipping up. So, bringing plants into our life and making them a staple of our nutrition is really important. So I'm always posting about that stuff. You can always email me and go to our website and find out more about myself and any of the doctors. So yeah, so if anyone has any questions, just let me know. I know that I covered a lot. If anyone wants to know some more information about this or has any topics for future webinars, you can always reach out. Let us know. We have them on our YouTube page, Inner Source Health. So there's tons of webinars that you can find from myself and the other doctors that work here at Inner Source Health. So if you ever have some topics in mind, you can. And then I know, I think Dr. Bongiorno is going next week. It's either Dr. Bongiorno or Dr. Vicky Leota, I forget. But there's another one coming up next Thursday too. So, so these will all be posted. Anyone who signed up today, I will be sending out a copy of this that you can get. And you can share it with anyone who might be interested in learning more about the differences between conventional medicine and naturopathic medicine. I know that I get these questions quite often. So I hope that this at least opened up the conversation and shed some light, maybe made you think about something. And I hope that it provided some insight as to what I do, why I love what I do, and how it may help you, and also empower you to know when you should seek certain doctors for your particular needs. All right, so thanks for joining me tonight, and I hope to see you guys soon and have a wonderful evening. Bye.